Today we'll focus on connecting Winnicott's concepts with DSM disorder. So I have prepared a table of it, but we'll first start with the concepts, brainstorm ourselves, and then go and see the table, how far we are able to decipher it.
Yes.
So the first concept of Winnicott that we have done is related to primitive agonies. That when we are born, we all have a fear of annihilation, falling forever, going to pieces, doubts on psychosomatic unity, loss of orientation, fear of psychological non-existence, fear of the ego disintegrating. Because as we said the other day, Winnicott's use of the word annihilation is actually related to the annihilation of ego, not to the annihilation of the whole system. That the ego is just forming and there is a fear of it annihilating. And this is what we are talking of, the system ego, not really a social ego. This is too early for the social ego. So let us look into it. If these things go wrong, then what disorders can one anticipate in DSM terms? So the first is self-disintegration. This is the classical feature of borderline.
I'm sorry, I did not understand. You were waiting for some answer? Which disorders can we anticipate?
Yeah, please go on.
Please, it will be very regressed, advanced, disorganized schizophrenia, hebephrenia perhaps. That can be actually said to have fear of annihilation. Otherwise, what I remember is, in no matter how advanced the illness is, a modicum of ego strength is always intact, which
Correct.
lets the person understand if what he is doing is right or wrong, and what he is doing or what he is not doing. So, people claiming that I murdered somebody and I was completely psychotic is not actually completely true.
So we will have to differentiate there
Yeah.
between a bout of fear of persecution
Uh,
and other circumstances.
mhm,
Like when the bout of fear of persecution is there and somebody
mhm,
does something in self-defense or out of projection, that is, say, 20-25% of those murders. And the
mhm,
other 75% are, as you said, you can't watch them off by the label.
mhm. Absolutely.
So you're right. If this goes at the worst, we are looking at one of the worst forms of psychosis. If it happens slightly later, because one of the factors is when does this happen? Like the primitive agonies is very, very early. There's no question of it being late. And therefore, anything going wrong is more likely to get into psychosis, borderline, or best prognosis will be a personality disorder.
Yes.
And as
Mhm.
an adult, you will have the panic and manic states. So these are two brothers, panic and manic,
Yeah.
because both of them are containment problems. And both of them are suddenly occurring phenomena where you don't have time to negotiate with it. There is a very quick upsurge. And both of them have an energy dimension to it. It is not only normal affect, but apart from the normal affect, a very huge amount of energy which is produced in both panic and manic. Now, in panic, it is combined with anxiety, but the energy is there. And it
Yes.
works on the reverse, that actually the whole system goes loose. Whereas in manic, the whole system is toned up. So both of them have a very important energy component, which generally in analysis is left out. That we talk of effect, we talk of idea and feeling, we don't talk of the energy aspect of it. So primitive agonies, if you look at it, the first three will clearly point to psychosis or borderline at best. The best case will be personality disorder. And even in that, we'll be looking at borderline, or we'll be looking at histrionic, and bipolar will be a good luck to so to say. Because
Just
if you
before
do,
the
ah, sorry,
like 5 minutes before the lecture began, I was going to pieces because a reviewer had asked for our a question regarding did you do training of the clinicians before you undertook CFI trial, international field trial, and the old data was not accessible to me. Dropbox wouldn't open, and I thought, oh, I haven't failed to pay the subscription in time. Have I lost all my data? Now, where will I show my face? Going to pieces. But I recovered. I found one file. I'm happy.
so the first three are clearly pointing to psychosis.
Yes,
Borderline, best case will be the more fragile forms of personality disorder.
yes, yes.
Like in the list of 10, if you see borderline, histrionic, and paranoid, they are the
Mhm,
more fragile forms of
mhm,
personality disorder.
mhm. Even
Loss of
histrionic.
psycho, yeah, sorry.
Even histrionic are fragile.
Yeah, because what happens in them is the histrionic process has a lot of
Mhm,
similarity with psychotic and manic process.
uh-huh,
You can easily see histrionic going manic. It will
mhm.
be hypomanic. It will not be mania of the bipolar
Understand.
one. Yeah, because
That
even in histrionicity, you see the shades of suspension of reality. I mean, the common overlap between the two is suspension of reality.
yes,
The inhibitions are gone.
yes.
So the fourth one is loss of psychosomatic unity, which will lay the ground for somatization. And then loss of orientation is depersonalization, derealization. And the last one is acute form of dependent personality disorder, where they are struggling with the first A of mirroring, acknowledgement. That do people acknowledge my existence? Or am I one more piece of furniture that nobody notices? That if five people are sitting in the room, I am one of the five. Everyone comes and says hello to the other four. Nobody says hello to me. So that is an acknowledgement crisis. Then do they even acknowledge my existence? So this will be related to primitive agonists. Now let us look at the table, the ready-made table. What does it say? It says borderline, panic, dissociative disorders. Similarly, now let us come to the second one, facilitating environment. And we made a point that the primitive agonies are relieved by a good facilitating environment. And the good facilitating environment has maternal care, a good supportive family environment, reliability, emotional availability, and three important elements: handling, holding, object presenting. Just to revise, handling is the physical handling, holding is a psychological holding, and object presenting is how do you present a new object to the child. And this will create a template for how to deal with strangers. Do we look forward to them with happiness? Okay, we will have one more relationship, or do we look forward to them with stranger anxiety?
Whether we generate approach avoidance conflict in the child.
It is like the root of positivity and negativity with respect to people will get instituted at this part. So let us say
That's why,
some. Huh.
sorry, sir, I'm interrupting too
Please,
often.
please go on. Please.
Last, several years ago, there used to be some cartoons which depicted ghosts. The Adams Family, I suppose, that was the name of the cartoon.
Huh.
The Adams Family.
Huh.
And it was very nice. I liked it because for children also they presented ghosts with which you could deal with as if they were benign. There used to be only the hand of a person, only the hand is wandering around the room, or other ghosts, and you interact with them. So that took
Correct.
away the sting from the ghostness of their existence. So that was good.
So in our language, we will say it's a movement from paranoid schizoid to a depressive position.
Mhm.
The ghost is neither all bad or good. You have a medley of them.
Yes.
That you can have one ghost doing both good and bad things, or you can have three, four different ghosts. Some are good and some are not good.
Yes.
And that is one of the differences between East and West.
Mhm.
And Carl
Yes.
Jung used to say this, that the West has he would not use these words, but this is what he meant, the paranoid schizoid approach to good and evil.
To good and
Evil.
evil. Hmm.
Whereas the East has a more fused, synthetic approach, I should say, not fused, but
Yes.
synthetic approach.
Hmm.
Like for a Western person to accept Kalima, it will be
Hmm.
practically impossible.
Hmm.
He may go till Shiva, but to accept Kalima will be virtually impossible.
I understand. Otherwise, pinning up the demons at the entrance of the temple is more common. And
Correct.
these demons as the Kama, Krodha, Mada, Moha, Matsaradam, all those Shadripus, or
Correct.
Lord Shiva wearing the garlands of heads.
And if we
Nararupa.
look at the Mahavidyas, it's practically impossible
Uh,
because the kind of terror that they signify in the iconography.
I sir don't know. What is Mahavidya?
So Tantra has many different parts of it. Tantra is a world by itself.
Okay.
And Tantra has three broad categories: right hand
Mhm.
Tantra, left hand Tantra, and center.
Mhm.
So the right hand Tantra is more benign, more sattvic. It
Mhm.
does not go into difficult practices,
Mhm.
which will be tabooed by the society.
Mhm.
The left hand path goes into the extremes.
Mhm.
So the idea there is to do extreme things to quickly overcome the limitations and accelerate self-development sitting in a Ferrari. And they are not uh, ready. They are not ready to accept the speed of a normal car. They want to go in a Ferrari. So the left-hand path has the intense sadhanas, like sitting in a smashan or eating out of a human skull, and all kinds of observances which include liquor, sex, meat, and everything. So left-hand path has all the intense ways of sadhana, and one of the very intense ways of sadhana on the left-hand path is the sadhana of Das Mahavidya. So there are 10 goddesses in Das Mahavidya, and you can choose any of them and go ahead. There will be rarely somebody who is able to master all the 10. So people usually choose one, maybe one or two at max. Some people even go to three, but very rarely somebody will do all the 10. So you can call them 10 different paths of extreme intensity. And within them also there are some which are benign, which are more sattvic and less tamasic. Like Shri Vidya is one of them. So Shri Vidya is one of the Mahavidyas. So some of the most extreme there, for example, Chinnamasta.
Chin.
Chinnamasta, one of the goddesses of the 10. So that sadhana is done at towards the end because it has to do with identifying the I-ness of oneself. Now that is at the center of the whole psychological world we build around ourselves. So the iconography there is that there is a goddess who is holding head and out of 3 heads, blood is coming and flowing into her mouth. And the depiction of the iconography is key. When you kill the eye, then the rajas, tamas, and the sattva, they all return back to their source, and you are freed from them. Because there is no I to consolidate a center around which these things can revolve. Because it is the I who is seeking pleasure, pain, whatever it is seeking, including enlightenment. So when the I goes, even the desire for enlightenment is not there. Because that's the ultimate, the first brick of the whole psychic edifice.
Yes.
So that comes at the last. But the iconography is so terrifying that it will be virtually impossible for a classical Western mind to accept that as goddess and worship it and so. And it's psychologically very important to see what happens when you worship these terrible forms. Because over a period of time, if you actually do it, you will realize that you start not fearing the fearful form, and the love starts taking over. The love becomes more and more unconditional. Because the first time you see the picture, you're terrified. There's no question of love. You'll be full of fear and at times even disgust or any abhorrence, any kind of avoidance. But over a period of time, the mind not only undergoes gradual desensitization, but after the gradual desensitization is over, the positive outflow of emotion in a more unconditional way happens. So
I can imagine that. I can imagine that in behavior therapies also they say that gradually you can actually start enjoying your pain. If you do meditate over pain, that was one. And second was the fierce images. Actually, we are externalizing our own internal base emotions and instincts or vices to the extreme and then getting them really neutralized. And once you know that you also harbor them, you really become non-judgmental and empathic toward your patient. And no matter, like they said, not only the victim but also the perpetrator of a rape has a right to sit in front of you and take treatment. Otherwise, that remains in theory.
So, from psychoanalytic point of view, when you look at Mahavidyas, it is almost like a developed, mythologized version of the Rorschach test.
Mythology's version of
The Rorschach test.
Rorschach test. Oh.
Okay, what is deep inside of you, those elements are taken, put them in the form together, create a personality out of it. And the terrifying personality in a way depicts the terrifying disjointed materials inside. So you're taking those terrifying disjointed materials, casting them in the form of a mythologized personality.
Yes, sir.
So facilitating environment, what will it lead to? Any ideas?
This is all very nice. After recovery, actually, it will lead to enhancement in the personality, self-realization, actualization, and it is possible to bring out the best in you if you have no primitive agonies and a facilitating environment. Then it is the ultimate test of your capacity, actually.
Right. And if it goes wrong?
If it goes wrong,
Like
pseudo retardation, you will believe that you have no capacity, but actually you have. And if you meet a good therapist, if the parenting doesn't bring it out, then school gets another chance. And if you fail at school also, then the therapy at least should be able to deliver you.
Absolutely.
Yes.
So one way to connect the two is the facilitating environment is going to take care of primitive agonies. And if that goes wrong, then obviously what we discuss, something of that will come.
Mm.
And you can see in handling, if it goes wrong, there'll be fear of fragmentation. There'll be a tendency to somatize. There'll be a tendency to withdraw completely. If the psychological holding does not go right, then the containment will be a problem. And what is the outcome of containment? The outcome of failed containment always is panic, manic, and anxiety. And the worst outcome is erosion of self, which is borderline. And object present, sorry.
Inversion of self is borderline.
No, erosion.
Erosion of self. Okay.
It's like the self is fragile and one part is chipped off because of stress. And whenever one part is chipped off, there are cracks appear in the self and the regulating capacity goes down. So if you look at, for example, if you want to define in one line, then dependence and narcissism are self-esteem stability problems. That self-esteem stability is not there in dependence and narcissism. In dependence, it's too low, narcissism is too high. And both have to come to the healthy mid zone. So if you define in one line, dependence and narcissism are essentially self-esteem stability problems. If you define bipolar in one line, the entire chapter, we are talking of mood stability problem. So you see stability in different ways. That in in dependence and narcissism, the stability is not there in self-esteem. In bipolar, stability is not there in mood. And in borderline, stability is not there in self. So all the three are stability problems, but of different stability of different elements. Object presenting leads to how we view people, and are we anxious to attach or are we eager to attach? The anxious to attach will be many, eager to attach will be few. They will be the HR managers, sales people, political leaders, and so on. They are eager to go out and even talk to strangers. They don't fear talking to a stranger. They don't fear going into an office, even though nobody knows them. The anxious person will hire a consultant or an agent to do the work. And the eager person will say, I would rather go with the agent even if I have to go with him, but I will go with him. Next concept, primary creativity. If it goes wrong, then what happens?
All the time becoming paralyzed for somebody else.
So spontaneous gesture goes, it leads to many personality disorders. Like dependence, avoidance, paranoid, schizoid. They all don't have a good spontaneous gesture. They fear. Second will be, in more difficult terms, it will lead to concreteness of the psychotic. Because the concreteness comes out of collapsed creativity and play. And it can lead to repetition of the obsessive. In all those cases, the spontaneity is gone. The creativity is gone. And illusion, if it gets fixated, then we are looking at an overrated idea. It may not go to a delusion, but definitely it will go to overrated idea. In object relating, if it goes wrong, then we are looking at psychosis. Or we are looking at very difficult internal object relationships leading to personality disorders or chronic forms of depression and anxiety, or chronic forms of addiction. So let us look at the table. facilitating environment goes wrong, borderline, reactive attachment disorder. This is very interesting. Reactive attachment disorder.
Forgotten.
It is like there is avoidance to attach and avoidance to seek help even when necessary. Okay, you may be sick, but you will feel, Kenny, I will do all myself. I will not call anybody. There is a inhibition to call upon somebody. Complex trauma, persistent depressive disorder, autism, schizotypy. Now, if you look at handling somatic, conversion, and feeding and eating disorders. If you look at holding environment, borderline, PTSD, dissociation, panic, manic, somatic. The illusion and delusion, disillusionment is also related to optimum frustration. Like the good mother has to first provide and slowly frustrate. So if she frustrates too early, it is dependence. Too late, it is narcissism. Similarly, if the object cannot survive the destruction, then it is dependence and narcissism, or it is histrionism. Holding environment we did. Yeah, one more. Reliability and continuity. This is the stuff of bipolar and borderline. Both of them have unpredictability. And one of the differences we see in early childhood is that the bipolar had early life good experience of some months, after which the loss and attack was experienced. Whereas the borderline had very less good experience before which the loss and attack was experienced. And in borderline, attacks are far higher than in bipolar. But in both the cases, unregulated parent is involved. So unpredictable attacks are common to both, but the intensity is more in bipolar, and bipolar has less of early life good time compared to bipolar. Borderline has less good time than bipolar. It is like, let us say, after first 3 months of your age, you are treated very well, and then you experience loss. Versus you are treated well for 6 months, and then you experience loss. So the timing of loss is very important. And what happened before the loss happened is very important. Because if earlier you had good experience, then the core goodness is already there. The nucleus of personality already has been formed. If the nucleus is in trouble, then it's psychosis. If the nucleus is half in trouble, it is borderline. And if the nucleus is quarter in trouble, then it is personality disorder. And if the nucleus is perfectly okay, then we are looking at episodic. Then we are not looking at something lifelong. Because lifelong suffering is because the nucleus is in danger. And that means very early life something has happened when the nucleus was forming. Integration. As we said, the self may not occupy the whole space of the psyche. And there will be an outside inside. That a part of inside may be seen as outside. Actually, it is inside. So this will lead to somatization, parking in that part of oneself which one does not feel is one's own. Emotional stability will be in problem. So that is bipolar. Mood stability. Realization and personalization. We all know derealization, depersonalization. Good enough mothering. You can see a range of difficulties coming from here, because it all depends on two things. One, when did good enough mothering stop? Did it stop at 3 months, 6 months, 1 year? The later it stops, good prognosis it is. The earlier it stops, bad prognosis it is. Second issue, after it stops, how horrible was the bad enough mothering? The intensity of bad enough mothering. So the two combined will create the pathology. And it can be anything. Like if it is very difficult, like say for example, I'll give two examples. Let us say the mother is suffering from postpartum depression. And the postpartum depression is moderate. So the child feels good enough mothering is not there, because the mother is depressed moderately. Now, in Winnicott's words, good enough mothering is not happening. And to what degree is it not happening? The degree to which a moderately depressed person cannot perform. So let us say 50% of it is happening. But let us say the depression is severe. The mother is suffering a major MDD. It's a postpartum MDD. Then what do? It's just not happening. Except for feeding, the mother is not doing anything. Others are doing it. And most of the time when the child looks at the mother just does not appear sad. She appears almost dead. So there is a difference between a sad mother and a dead mother. And both will get internalized by the child. And the sad mother internalized will lead to chronic depression or a depressive personality disorder. Whereas a dead mother will lead to bipolar or histrionicity. Much of histrionicity is actually a reaction formation defense against a dead mother. They go hyper alive to escape the deadness. Because if they don't use reaction formation, they will sink into a very deep depression. So the depressive core is very strong, and to escape it, you require equally fearsome reaction formation into a hyper aliveness. Or it can be hyper aliveness of the histrionic or hyper aliveness of the bipolar. In both the cases, you will see fragments of mania. Bipolar, directly we call it mania, but often in histrionicity, you will see mania. Softer form of mania will go along with histrionic behavior, because both of them are dealing with deadness or sadness. And bipolar cyclothymic will be dealing with a internalized, and bipolar 1 will be dealing with a dead mother internalized. The difference will be the internalization of histrionic will be less than internalization of bipolar 1. Because the histrionic in the childhood, even if the mother is dead, will have somebody alive in the environment taking care. And that alive person also will be partly internalized. So usually it is the dead mother and the alive father. in histrionicity. And if the alive father is not there, he is also morose, he also looks serious and gloomy, then it is more likely the person will go to bipolar. So good enough mother, if she is not good enough, the first problem is attachment disorders. Borderline, narcissistic, avoidant, dependent, a range of personality disorders. Concern for others, if it is not there, then we have to look at antisocial. As Winnicott says, the child has the right to exploit and the mother has to allow the child to exploit her. And after inadequate exploitation, automatically the guilt, reparation and concern comes. But if that has not happened, then one repeats what was denied in the childhood to complete the arrested developmental process. So softer form of antisocial for Winnicott was a restart of the developmental process. That he is trying to exploit what his mother did not allow him so that he could actually go into guilt reparation and build concern on a stable basis. So actually the soft delinquency is actually a call for the superego. Ironically, you are going against the superego in order to establish a superego.
Cry for help or always
Yes,
invoking the need, like withdrawal syndrome of superego.
correct. But if it is very acute or the constitution also goes against the capacity for concern, then we are looking at very different kind of antisocial. So when we are looking at psychopathy, then this will not apply. In sociopathy, in mild sociopathy, it will apply. In moderate, depends on case to case, but severe sociopathy or psychopathy, it will not apply. The potential place, space, and play. So what happens if creativity, play, symbol formation collapses?
Deprived inner world.
So it is
That
completeness.
it's not populated by healthy, internalized good objects, stable, reliable.
It's a poverty of the inner world, which will reflect in poverty of speech, poverty of expression, poverty of body movement, all that we see in MSc, right? In mental status examination, all the poverty elements that we have, all the poverty elements will be there if the play collapses, the creativity collapses. And there will be repetition because you have few entities with which to play and you keep playing again and again. And there will be concreteness because symbol formation has collapsed. And it leads to very difficult thing in therapy. Like I had given two examples of how you cannot use metaphoric language when the patient is in concreteness. The first example I had given is that a patient therapist tells the patient, so it seems you are haunted by the ghosts of your past. And the person suddenly starts looking around the room, okay, where are the ghosts? Because he is not looking at it metaphorically, he is looking at it concretely. He really feels I'm still haunted by the ghosts. Or the therapist says, if you don't put up this wall between you and me, can we take a deeper look at your feelings? And the patient starts looking, where is the wall? And he says, there is no wall between you and me. Where is the wall? because the metaphor is now not understood. He is into concrete language. And the collapse of the metaphor, which is so much a part of our everyday language, that is the result of the symbol formation collapse, which is a collapse of creativity and the collapse of play in the verbal space. And in therapy, we have to allow that play. So the therapy space becomes a transitional space where the play between reality and fantasy, play between opposites, play between the conscious and the unconscious, the play of active imagination in dreams, all of that happens. So if there is no adequate creativity in the therapeutic space, it's a problem. That the therapy space has to be a play-rich space. That we have to be able to look at what cannot be looked at outside and look at it from different points of view. So what is the collapse of play? It is autism spectrum, where the metaphors are not understood. Major depressive, childhood trauma, and psychosis. All of them involve concreteness and fall of symbolization. Potential space, autism, schizoid, MDD, psychosis. Those psychosis with a feature of concreteness. What about the transitional object? It will deal with separation. If the transitional object phenomena fails, then we are looking at separation anxiety. And if the loss is very early, no amount of transitional object will help. Like what happens today, we have normalized the abnormal, which is the mother going to work at 3 months after the leave. It's a recipe for an epidemic of personality disorders. The mother starting to work after 3 months. The child is no way ready for a separation. The internalization of a mother will take months ahead. And without the mother being internalized, if the mother is absent, the abandonment is real. It's no longer perceptual. And that is what has created the epidemic of personality disorders now. Mothers starting to work after 3-4 months of leave. So separation anxiety, childhood anxiety, autism disorders, they all come from transitional object. Separation anxiety often causes people a great deal in their careers. They are not able to move out of their cities. They find it difficult even to change a society. Even after changing the house, they still feel nostalgic about the old house. And this becomes worse if the man is not successful. And this we see in midlife. That if the separation anxiety is there, separation is not easy, and you reach midlife and you are a failure, which most people in society will be. Out of a class of 50, 10 will be extremely successful, 30 will be moderately successful, and the bottom 10 will not be successful. So when we look at that kind of thing, and when you go to the mass society, the bottom will be much bigger. So it is said that the successful people, they live in future. The moderately successful people, they live in the present. And those who are neither, they live in the past. Because there are only three places to go for the mind. There's no fourth place to go. So if you are not successful and if you are not loaded with responsibility, then you go to the past. And that is what happens in the midlife, that a large section of population goes to the past. So often children now we don't see that archetypal people, but in my childhood, they used to be there. Some uncle who would keep talking about his past. About 1940 and 1950, you would always have characters in every society who would keep telling stories of the past. Now, of course, you don't have them.
There's a nice Marathi poem also, which spoke about, I suppose it was by Keshav Sud, and he criticized about people who are praising their ancestors. And the line goes like, त्यांना पूर्वज नव्हते काय, कशाला पूर्वजांच्या मजा गमजा मारताय, गोष्टी सांगताय, त्यांना पूर्वज होतेच की. किंवा रामदास जसं सांगतात की सांगे वडिलांची कीर्ती तो एक मूर्ख.
So it is such a strong phenomenon. I term it by the phrase, the dream we never had. We project that once it was so. Actually, it was not. But retrospectively, we project a good world on our past. And we create good objects because we don't find good objects in reality.
Exactly. They fill the vacuum.
Correct.
It is like an alcoholic patient getting, what do you call that? Oh, I must not do that. Filling the memory gaps by deliberate lies. Lies.
So it goes.
Pseudologia fantastica. That is different.
So we create stories for ourselves.
Yeah.
Because that is the only way to bear reality.
Lullabies.
So this is the kind of the dream we never had that we create once we had it. And that allows us to go on because otherwise reality is too difficult. And this is how ideologies also operate. So there is a good book by Zizek called The Sublime Object of Ideology. And he says this sublime object of ideology is, we believe that this sublime object we once had that we have lost, which we have to recreate. But in reality, we never had it.
Sir, may I interrupt for a moment? The other day, last Sunday, I suppose, there was an article about Spider-Man and the cast in their stories, Spider-Man stories. And they spoke about toxic masculinity and how he always acts as a protector. I thought such is the fairy tale which is required for now. In the current times, we actually need such a fairy tale because people need to believe that somebody will come and save them.
Correct. So whenever a crisis comes, we all want an omnipotent savior.
Yes.
It's a natural need of the mind. How else will you manage that anxiety when the anxiety is real? See, you can analyze and get over perceptual anxiety or anxiety which is not real, but you can't analyze out a real anxiety.
Here, yeah.
So psychoanalysis will set you free from fantasy.
Absolutely.
But nobody can set you free from reality. You can increase capacity to some extent, that's fine. But 75% of problem still stays. So psychoanalysis is not a discipline to change reality. At best, it can change our approach to reality. But the reality, brute as it is going to impact. And the tool for that is politics. It's not psychoanalysis.
I completely agree with you. They can play with the lives of the masses and they understand the needs of the people, and they can and they should actually set the taste of the masses, what the masses should aspire for and what they should not, and then guiding them on the path. That is such a full, complete leader.
So our world is the world of goodness, thought, and feelings. It is not a world of power. And the world of power is politics.
Mm.
And when it comes to mass society, it is power that works, not only thoughts and feelings. Occasionally they may work, but in a steady state situation, it is power that works. When revolutionary time comes, then some ideologue, some political leader who has thoughts and feelings, and he arouses everybody. But those are very small, concentrated periods of history, the revolutionary times. But
Yes.
generally, in a steady state situation, it is the power that operates, not ideas. It's the power. So what they call toxic masculinity, actually this has been extended beyond limits, the whole idea of toxic. So this is a woke phrase, toxic masculinity.
I don't understand these new terms completely well. Woke or toxic masculinity. I'm yet to study along those lines.
So I went through it, and then as a counterpoint to it, I wrote something which got me many brickbats. And that was, I wrote I extended this. I said toxic masculinity, toxic femininity, toxic everything. Because anything which is out of context and out of proportion can be toxic.
You invoke Dasha Vidyas at the same time.
So I said anything can go toxic. Like Ayurveda says, anything can be nectar and anything can be a poison. It depends upon the proportion and the context. You
And
eat
the
one, yeah, you eat 1 kg of salt, it can become poisonous.
Absolutely.
So anything can become a medicine and anything can become poisonous. So I wrote it, and then people came back upon me very heavily. So true and the false self. What would the failure of each lead to in DSM terms? Extreme of the false self will be multiple identity. Second will be chronic depression. If you are not able to live in the true self, again you will have personality disorders, depression, addiction. Extreme false self can also be body dysmorphic disorder, the imposter syndrome, social anxiety. So true self impairment, chronic depression, avoidant personality, dependence, schizoid personality. False self, narcissistic, dependent, obsessive, avoid. Extreme of false self will be multiple identity. Some will even have addiction. Very interestingly, there will be a group of people who will bring out their true self after they are drunk. Going on being. When too many interruptions happen, what happens? You can have bouts of anger. I don't remember the name. There's a name for it. Intermittent something.
Explosive disorder. Intermittent explosive disorder.
Correct.
Or mania potu, in which such a small dose of alcohol can give rise to huge disinhibition and anger, violence, rage outbursts. Or if you take cannabis, then it is amok, running amok, AMOK. That is also rage, gone out of hand. So
correct. So this going on being, if it is impaired, it leads essentially to irritation being bottled up. Because every time you are intruded, you feel irritated and angry. And this also leads to low cohesion of the coordinator. So the resilience goes low. You become predisposed to easy disintegration. Capacity to be alone, if it is impaired, it leads to both extremes, dependence or narcissism. So continuity of being, when you're intruded too much, and if it is unpredictable, then we are looking at borderline or bipolar. Disassociation, depersonalization, derealization. And you will have also some forms of depression where intermittent explosion happens. The capacity to be alone, if it is impaired, we look at dependent, borderline, and separation personality, separation anxiety. Because then you can't separate. Use of an object. Too much use of an object will lead to exploitative narcissistic personality. Antisocial personality. Unnatural demands made by the borderline personality. Similarly, unnatural demand, unreasonable demands made by histrionic personality. And too little of it will lead to dependence. In dependence, there is too little use of object. It's a hypo problem, not a hyper problem. And the problem there is, do I have a right to ask? Do I have a right to tell somebody you do this for me?
guilt for existence.
Sorry?
Guilt for existence.
Correct. And
Why was I born?
And not being a burden, not being a burden.
Yeah, not being a burden.
It's like when you exercise a right to ask, you are troubling somebody no end. It's a hyper assessment of trouble.
Yeah.
When in fact it's a very normal thing to do. And it's also contractual and two-way street, that you have done ABC for him and then you're asking him to do A. So if you draw a balance sheet, you are still in credit. But even when you are in credit, you don't ask for a two-way street. You are okay with a one-way street. And that is to do with too little use of an object. And the roots of it are, one is, do I have a right to ask? Second, not to be a burden. And third is the fear of loss and attack. And
Fear
fourth,
of loss
an attack.
and attack.
And the fourth is to see everyone happy and not to trouble anyone.
Hmm.
Concern and reparation, if they are not there, we are looking at antisocial, narcissistic. Creativity, when it goes too low, we see schizoid, at times even schizotypal. Persistent depressive disorder, and concreteness in psychosis. Any thoughts on how Winnicott connects, or Winnicott does not connect, actually we connect. Winnicott never wrote his concepts with DSM in mind.
Winnicott is more perceptibly connectable with DSM because, like DSM is phenomenological, Winnicott deals with phenomena,
Correct.
whereas Freud deals with all the abstraction. Object relations go more toward abstraction, whereas Erikson perhaps could come closer to Winnicott in being tangible and observable, and perhaps that is what cultural psychiatry approach also does, that we take verbatim. In that context, I like it because it is like psychoanalysis. Pay attention not only to what is said, but how it is said, and what is not said, and who did not come with the patient, all that. And then there you take it as a gospel, patient is the God, whatever he said is right for us, and we analyze that. So that you are doing your job at the same time, medical legally safe, and you are also fulfilling. You can prepare formulation for any kind of therapy. It may be CBT, it may be REBT, it may be other experiential therapies, because you have the raw material. All the raw material is with you because verbatim is there. So
Correct.
Winnicott is because he deals with phenomena and maybe subsurface level. So he also entertains the concepts which are below surface, like holding environment, handling. There is some symbolic and abstract thing also, dimension to his theory. That
So,
is what I think.
so we can look at something at the process level, we
Yes,
can look at something at the molecular level, and we
yes,
can look at something at the atomic level.
yes,
So the more elemental you go, the more abstract it becomes,
yes,
because the phenomena is in front of us, the process. Now, when you start deconstructing the process in causal terms, you will first go to the molecular level, then to the atomic level. And the more deeper you go, the more elemental you will go. And the more elemental you go, the more difficult it will be to construct the model of the mind. Because if you want to really go elemental, then you have to have a very strong grip on theory and building the model of the mind.
and those who read it also need to have that. Otherwise, you are a theoretician to yourself. It's not tangible for others.
Correct, correct, correct. So the like when we look at Klein, she talks at very elemental process level.
Yeah.
See, we are still not at the constructional elemental level. But in process terms, we are very deep. That we are still looking at process within process within process. Like a macro process, you don't have to directly go from a process to a molecular level. From a macro phenomena, you can go into processes and still deeper processes and still deeper processes. And when the processes end, then you can go at the molecular level and then to the atomic level. But Klein is dealing at a very deep process level. So that way, Winnicott is very macro and therefore easy to catch hold of and actually even verify. Like to look at, for example, Klein's concept of the split and the omnipotence. It may take years before one experientially catches it in oneself. But Winnicott does not go into that kind of deeper abstraction. It's like a two-step away from phenomena analysis.
Yes.
The only part where Winnicott kind of goes very deep is when he talks about the primary agonies and integration. Those are the only two concepts that are really not 2 steps away from the process, but many steps away from the process. Should we break for a cup of tea?
Yes, sir.
And complete the therapy part.
Thank you, sir. Rudolf Virchow or somebody, he said pathology is nothing but altered physiology. And illness is nothing but altered health. So you have to understand the process and how should help the people travel along the line.
So Winnicott looks at pathology in a distinct way, and that colors his therapy approach. Because as we said before, every school of psychoanalysis will need to have consistency across their model of the mind, pathogenesis, and healing approach. Now, every school does not have a model of the mind. Like Winnicott never created a model of the mind. And therefore, in Winnicott school, we don't have that compartment to engage with. But what we have here is pathogenesis and therapy. And therapy always is a function of pathogenesis. Based upon what you believe the cause, so will be your healing method. So Winnicott believed that pathology is a developmental arrest, which is very different. Right? For Freud, it was a conflict, an unconscious conflict of drives. It was a conflict model. That there was a conflict between the drives and reality or drives and morality. So it's a conflict model of pathology. Klein had an object relations model of pathology. That early object relations have gone wrong. And because early object relations had gone wrong, pathology later developed. So Freud had a conflict model of pathology. Klein had an object relations model of pathology. Jung had an individuation frustration model of pathology. Kohut has a self-formation model of pathology. And Winnicott has a developmental arrest model of pathology. Now, Kohut has both developmental arrest and self-formation. Winnicott does not go into the self part of it, but Winnicott definitely sees pathology as a developmental arrest. So his approach to pathology is very different. It is not like Freud, not like Klein. It's a very different approach. Like Bion had epistemological model of pathology. That certain things could not be processed, could not be contained, and therefore pathology. So each has a different approach when it comes to the root of pathology, why pathology develops in the first place. So that fundamental question is something on which all of them are different in their opinions. And based upon what is their opinion on this fundamental question, their flavor of therapy will come about. So when we are looking at Freud, we will be looking at analyzing the drives, analyzing unconscious desires which cannot be accepted and owned up, like Oedipus. And we will look at first exploring those difficult to explore parts and finally do reality acceptance. In Klein, we will try to rework the early object relations in something. In Bion, we will try to build the alpha capacity to process the material and the containment capacity to contain whatever cannot be processed, so it does not overflow into pathology. Similarly, in Winnicott, we will be looking at restarting a developmental arrest. We will be looking at restarting an arrested process of development so that it completes itself into health. Similarly, in Kohut also we will look at a developmental arrest, but with an additional concept of the self. That will be the difference. But both of them are into viewing pathology as a developmental arrest. Both Winnicott and Kohut. So for Winnicott, it is a developmental arrest. Then what is the way out? To restart the developmental process and undo the arrest. The developmental process was going on, it was arrested. Now you remove this part and allow it to proceed to completion. So the focus is to undo the arrest and allow the developmental process to restart. So this is one of the axioms of Winnicott, that pathology is a developmental arrest. That does not mean it is an absolute truth. It is Winnicott's opinion, and maybe in some cases it is true, and in some cases Freud is true, and in some cases Klein is true. We don't have to be in an or situation. We can be in an and situation. So pathology is a developmental arrest. The developmental process can be restarted. So whatever has been arrested can be restarted. Interpretation is not the primary tool. It is used, but it is not the primary tool. Catharsis is not the primary tool. It happens, but it's not the primary. Winnicott is not a hydraulic theorist at all. You can call him one of the least hydraulic of all theorists. And ISTDP is the most hydraulic of everything. So in ISTDP, we are just looking at if anger, sadness, and guilt are repressed, we have to feel them and let them go. And whatever is the problem, ultimately it is this. So Winnicott is not hydraulic at all. He is not into that kind of thinking. Emotions are blocked and release of those blocked emotions will relieve pathology. That's the hydraulic way of thinking. That just as in a dam, the water is blocked, in the complex, the traumatic complex, emotions are blocked. And if you can release those emotions, the complex becomes harmless. So Winnicott is not into that kind of hydraulic thinking at all. It is by providing. Yeah.
Is it so that he is not giving so much importance to, uh, say, trauma, so that he says catharsis or interpretation are not the primary tools? He speaks more about the process rather than the traumatic event.
Correct. So there are two parts of it. One, his idea of trauma is not a hydraulic trauma, it's a non-hydraulic trauma. Trauma
It's
is
a process.
there.
It's a process, not the event.
No, the inside the child, something will happen. that you can call trauma, but the trauma, there are two parts of it. One is between constitution and environment, he is heavily into the environment. So the inner process is like what Klein talks about, the death instinct, the inner representational world, the inner relations which happen automatically, even if the child is sitting with eyes closed. The fantasy is automatically generated. The death instinct and envy automatically arising. So that kind of an innate drama happening inside constitutionally, that Winnicott is not there. So Winnicott, one, is completely into environment, very less into constitution, number one. Number two, when the environment, something goes on in the environment, something happens in the child, which we can call the trauma. But Winnicott's trauma, way of looking at the trauma, is not a hydraulic trauma. It is a non-hydraulic trauma. For example, he will say, if the environment is not good enough, you will not have the courage to live out your true self. You will put up a false self to deal with the environment. And that is traumatic. But Winnicott will not say that the environment frustrated you, attacked you, dismissed you, laughed at you, and it created sadness, anxiety, guilt. And because you did not want to feel this, you put up a false self. Actually, it is happening, no doubt about it. But Winnicott is not focusing on those hydraulic events. He does not bring in, you develop the false self, because when you try to live the true self, you experience a lot of sadness, anxiety, guilt, shame because of something in the environment. So in a way, he's putting aside the hydraulic events, the affect generation events. So you will not find the affect generating events being in the center. He will only talk about the environment was not good. It was attacking, it was dismissing, it was ignoring, it was cold shouldering. Now he will not go how that cold shouldering is happening inside of you. What is it doing inside of you? So ultimately affect will be generated. You cannot have a situation where environment does something and you don't have affect generation. But Winnicott's focus is not that. What his idea is that environment is not allowing you to live out your true self. Now, if you go deeper, why are you not able to live your true self? Because the environment is dismissing, attacking. So what does it do to you if the environment attacks or dismisses? Of course, it generates the fundamental feelings and you don't want them. But Winnicott is not focusing on that. Does not mean that don't happen. Because Winnicott does not focus, does not mean those events don't happen. But his focus is not on those hydraulic events, even though they may be occurring. His conceptualization is that because of the environment not being facilitating, you put up a false self. His account of it is not hydraulic. Now, elemental hydraulic processes may be happening, which may be leading to a macro event of putting up a false self. But Winnicott restricts himself to the macro event, does not go into the causation of the macro event. And that is what makes him very, very unhydraulic. He is not going into the bottling up of affect. That does not mean it's not happening. So Winnicott says, if the facilitating environment has failed, then empathy has to be provided in therapy. Facilitating environment has to be provided in therapy so that the healing proceeds. Because at some point, the developmental process was arrested. Now, we are not going into the ideational and affective component of that arrest. We are only remaining at the macro environment level. So, Winnicott that way is not only not hydraulic, but also very macro. He is not going into why the true self cannot come in the front. Why do you have to put up a false self? We will say to cope up with the environment. But what is this coping up with the environment? Of course, it is to avoid pain and enhance pleasure. So while affective events are happening, Winnicott is not into those micro affective events. He is at the macro level and is as non-hydraulic as possible. So these are very two important characteristics of Winnicott. He is non-hydraulic and he is macro and he is environment focused in terms of causation. And in terms of healing, he is provide the enabling environment. So what is his healing process? First, provide a holding environment. Meaning, you push for later the interpretation process. You push for later the catharsis process. You push for later a difficult analysis. Initially, just provide holding and empathy. Safety, support, and goodness in simple words. So if you can provide safety, support, and goodness, the facilitating environment is provided, holding is provided, empathy is provided, and slowly the developmental process restarts even without going into elemental issues of affect and ideation. Just be at the macro phenomenological level and it still works.
Maybe synthesis is more important for him than analysis, if I say that.
Correct. For him, it is the process which is important, not the elements which are in the process.
Yes.
He is not interested in deconstructing any process. He is at the operative level, not in the elemental level. So at the operational level, what is the process? Now that operational process, you can always deconstruct down to the elementals. But he is not interested in the deconstruction. He is just interested in that operational level. Okay? Operational level, at what level you can catch the phenomena in terms of recognition and in terms of working with it.
Yes.
So in that sense, he is very macro, unlike Freud and unlike Jung and unlike Klein. He is far more macro. So the idea here is that these are the axioms. And then what will be the way out? To provide holding, to provide empathy and a facilitating environment so that the developmental arrest can be released, the arrest can be released and the developmental process can restart. So what will be the process like? It is on the couch, 3 to 5 days, classical psychoanalysis. And in the facilitating environment, you have to focus upon handling, holding, object presentation, consistency, reliability, constancy. Which means you should be available in the therapy room, same time, same place, consistently. And whenever you bring another subject or another person into analysis, the object presentation has to be well managed. So we are focusing here on holding, not on interpretation, not on transference analysis, not on projective identification, and not on justice. Like the patient can score points over us, may even exploit us in a mild way, but we don't give justice to him. We allow him to exploit in this approach. And of course, this is mild exploitation. It is not a major exploitation. The therapist has to survive the aggression and exploitation. It may be mild, for example, coming 10 minutes late and asking you to extend the session by 10 minutes. Not paying on time and paying in a delayed way. You allow the person to own up his whole body and the space of the self. So if parts of him are not being seen as extension of him, you bring it together. That this is also a part of you. We have to integrate that into a whole personality. Or part of the body is not taken care of. You can point it out to say, okay, this part is also a part of the body. You are embodied there equally. The embodiment is across the body. Similarly, there can be parts of the mind which are almost treated as though it's not me. Okay, there is a corner of the mind which is almost not me. So that embodiment, that owning of that integration has to be facilitated. Authenticity, encouraging play and going on being. Don't make too many interventions. That will disturb the going on being. Encourage play, encourage creativity. Encourage finding of the true self by asking, like one of the tools is articulation of desire. That if there was no fear, no greed, what would you do? When there is no compulsion from outside, what do you do? Those are your desires. When you go on a holiday and you have nothing to compel you, what do you do? Initially, it may be sightseeing because you are going there. But after some days when everything is seen and you are free, then what do you do?
Fantasy.
Or if I give you a vacation of 10 days, you may take rest for 3 days. You may complete your work for 2 days, whatever is pending. But last 5 days, what do you do? And many people find it terrible because they are not able to find out what is their true self. So what you do spontaneously without greed or fear is something that you really like. And very few people know what they really like. And if you can find out, so first is articulation of desire, and second is analysis to help help one recognize one's authentic self. That if what lot of things we do is because of society, so what is the authentic self and how far can it be lived out? And one of the very good tools is articulation of desire. That very few people know what our real desires are. Especially the more you age, the more difficult it is because layers upon layers upon layers build up. So the articulation of desire, finding out what you do when there's nothing to really do. And when you do that, you don't feel tired. And you get a different sense of satisfaction. And mostly, when you do that, luck also helps you. So if that can be converted into a profession, that is ideal. If it is not possible, then you can leave it out as far as possible. Winnicott says, over a period of time, this holding, this empathy is internalized. And what Kohut uses the word, transmuting internalization happens. Meaning, what is internalized after some time does not require the outside person. It now becomes your own. You have developed the capacity. That when you are learning a new skill, initially you need a teacher. So you do something and he tells you this is right, this is wrong. Then after some time, you don't need him to be with you. He can be in his cabin. You can do your work and show it to him. After some time, you can do 10 times the work and he can pick randomly something for quality checking. And after some time, you don't need him. You have internalized everything. Now you have your own quality control inside. So that capacity has been internalized. The capacity that you are borrowing or having on rent from outside, now it's yours. You have internalized. You have developed that capacity. So Winnicott says the holding, the empathy, the going on being, the capacity to be alone the peace, the bliss, those capacities are also developed in them. And they are internalized. And after that, the person does not need the therapist. The capacity to be alone and to be in bliss and creative and playful, this is very high-end capacity. This is like much after the symptoms are gone. Like you can do both of them together, they don't have to be sequential, but the radical effect of it is after the symptoms are gone. Otherwise, you will have alterations. You are alone, blissful, playful, creative. After sometimes the symptoms become active and again you are in turmoil. So you are living two different states. But to make this steady state is a high-end achievement. And Winnicottian therapy can also include a lot of creativity, do-it-yourself exercises like the squiggle game, that you draw one line and the child draws one line. And Winnicott's concept easily include art therapy. Art therapy is very easy to join into Winnicott's concepts. So creative do-it-yourself exercises, creative joint exercises, especially with children, and art therapy can easily be used with Winnicott's approach. What are the therapy goals? Internalization of good things, holding, empathy, going on being, integration, personalization, and realization.
I lost a couple of sentences. Internalization.
Okay. I think
There was some problem with the connectivity for a moment.
I just corrected. If you look at Winnicott's goals of therapy, one can start integration, that you feel the whole of the psyche is one and there is no outside inside. Then there is personalization, clear identity between me, who am I, and the other, who is he. I and not I clearly differentiated. So I has distinct characteristics and not I has distinct characteristics. Identity formation on both the sides and acceptance of those identities. Realization that the world out there, there is an objective real world and does not collapse with my subjective belief or disbelief, my perceptual engagement or non-engagement. Internalize the holding. Psychosomatic attunement. Bringing forward the true self. Develop capacity for concern, creativity, play, and resilience. The autonomy of oneself to exert one's desire, one's uniqueness, and not always defer to others. The going on being and the capacity to be alone, and when alone, creative, playful, and blissful. So these are the goals, and of course, they are based upon the concepts of Winnicottian therapy. How has the therapy evolved? How has the school evolved after Winnicott? Part of it has contributed to attachment theory, some part to infant observation, some part to relational psychoanalysis, intersubjective psychoanalysis, contemporary object relations theory, self-psychology, developmental trauma, mentalization theory, play therapy, and very importantly, child and adolescent therapy, because Winnicott did a lot of his work with child and adolescents. So many of his ideas and observations are very relevant. And in play therapy, the two go together. Who are the important thinkers after Winnicott? Many of them. But if you don't have time and you want to read some of them, I have put those names in big letters. Thomas Ogden, Masood Khan, Michael Bellind, Fairburn. These are some of the very important. And my favorite is Andre Green, who has done very good work on death instinct. So these are the important thinkers who have in different ways taken something from Winnicott, developed on their own within Winnicottian school or outside Winnicottian school, but develop the ideas. So with this, we complete Winnicott, and next time we will take up Heinz Kohut. So Heinz Kohut uh, is one of the radical departures in psychoanalysis from the classical psychoanalysis. So the departure is so radical that we actually call it a self-psychology. So the departure is as radical as Jung. Like when you talk of Freud, Klein, Bion, Winnicott, we just use the word psychoanalysis. But when you talk of Jung, you use a different word called analytical psychology. When you talk of Kohut, you use a different word called self-psychology. Although they are forms of psychoanalysis within the psychoanalytic world, but radical departure from the earlier mainstream.
And what do we call Winnicott's approach?
It is not given a separate name except that he used to belong to the independent group. And another name given to his therapist school is soft object relations.
Soft object relations. And Fairbairn?
Yeah, so
because we attended the lecture by Ames Delhi doctor and Sharan Pratap Sharan. And he gave a very nice way of how Fairbairn completely splintered out and how he was different from, he was from Scotland and he shifted out from analysis, radical, this thing.
I'm not very actually well read on Fairbairn,
Okay.
but let me just go through it and see how it gets classified.
Yes, sir.
So should we stop for the day?
Thank you, sir. And shall I introduce that one is that actor lady who acts in these films and not films, theaters. She's a theater actor. And the other lady I remember just now, she has returned from Gulf. She's a psychologist and she takes, what can we say, sessions for interns or something like that.
Very good.
Not very in-depth kind of work, but reaching out and connections and helping people. So I may share your number with them. They will contact you and you decide.
Sure.
Also, I did not ask you so far about the patient that I referred. I came to know last visit. I asked him, Amit Bise, and he said, "Sir is not taking fees from me because I explained my difficulty, and he said I'm good going. I don't need your fees." So
Yeah, there's
I,
some financial difficulties.
I was amazed. The problem is he may not have told you everything, and I don't know. I didn't want to bring that up. Should I or should I not? What should be the case?
Let me do one thing.
Uh,
Should I end this and reconnect with you in a moment?
no problem.
It
No
will
problem.
get recorded otherwise.
Oh, I'm so sorry. I took the name. I'm sorry.
कोई बात नहीं.
You did-
I'll send a new link.